afternoon, New York City, and good afternoon to the families, leaders, and partners who have come from across the country. Today, in the heart of Times Square, we gather for the 4th annual National Fentanyl Prevention and Awareness Day, a day born from tragedy, sustained by courage, and driven by the unshakable love of families determined to save others from the same fate. This year, our theme is a single word that carries us forward: hope. This day is dedicated to honoring the lives stolen by fentanyl poisoning, standing with the families forever changed, and warning the American people about the deadliest drug crisis our nation has ever faced. It is a day to share the truth, to educate our communities, and to light the way forward with hope. Hope that together we can save lives. Let us be clear. This day is not a day for politics. This is not a day for division. National Fentanyl Prevention and Awareness Day is a day of unity, compassion, and of hope, standing stronger than fear. This is a bipartisan effort where every American, regardless of party, position, or background, can stand together with one mission: to save lives. We are here to urge our government agencies, federal, state, and local, to keep working toward a fentanyl-free nation. We are here to thank the men and women in law enforcement, public health, and community leadership who have answered the call to stand with families. Today, we mark a moment in history as grieving families, grassroots leaders, and our nation's top federal agencies stand shoulder to shoulder against the most lethal drug scourge America has ever seen. We stand not just in grief, but in hope. Hope that our work will prevent another family from standing where we stand now. Hope that our nation will act decisively and compassionately to end this scourge. We remember the loved ones taken from us far too soon. We warn of the dangers still claiming lives every day, and we unite in action, in hope, and in unwavering determination to end this crisis once and for all. Together, today, we stand. You are not alone. We are a nation united by hope, and together, we will save lives. We understand that today can be very emotional for everybody. If anybody finds themselves during this press conference or during our time here in Times Square to be very emotional and they're struggling, over at the Facing Fentanyl table is Partnerships to End Addiction, and they are here to offer their services if anybody needs it during this time. Thank you.
Welcome to the 4th Annual National Fentanyl Prevention and Awareness Day. 4 years ago, I made a phone call to DEA headquarters. I called my friend John Delana. I said I needed a little help getting something together in New York City. He said, I'm going to make a phone call to Frank Tarantino. He'll take care of everything you need. Don't worry, Andrea. This is our 3rd year in New York City, a place we were told that we could never stand like this. We're here now. Your voice is loud. We make a difference. And we thank our men and women of DEA for bringing us into the city, finding the support that we need, and helping us every step of the way. Families, this is Mr. Frank Tarantino.
Good morning. As Andrea said, my name is Frank Tarantino, and I'm the Special Agent in charge of the Drug Enforcement Administration's New York Division. I want to thank Andrea Thomas of Facing Fentanyl and Voices for Awareness, Jaime Puerta of Victims of Illicit Drugs, Michael Fiore, the Black Poster Project, and the Ladder Foundation, as well as our DEA team and everybody else that made today possible. Thank you all for being here today. A tidal wave of overdose deaths and poisonings have rained down on the United States of America. This death and destruction has been primarily caused by Mexico and China. The Chinese criminal groups and Mexican cartels are responsible for the mass production and supplying of the vast majority of fentanyl, powder and pills, and methamphetamine that is floating into the United States at catastrophic and record rates and killing Americans. My message to you today is we are turning the tide on overdose deaths and poisonings, but not the page. I want to begin on this National Fentanyl Prevention and Awareness Day by acknowledging something we haven't been able to say nearly enough in recent years. Overdose deaths are declining. We have gone from 112,919 American lives lost in 2023 to 84,076 in a 12-month period ending in October of 2024, a 25% decrease. This is the largest percentage decrease in the history of this ongoing opioid crisis. This is no small accomplishment. It reflects the tireless efforts and dedication of our DEA special agents, task force officers, intelligence analysts, diversion investigators, healthcare workers, first responders, community organizations, harm reduction advocates, policymakers, but most importantly, those in recovery, their families, and the families of the lost. Lives have been saved because of all of them, because of all of you. Families have been spared the unbearable grief, and our communities have experienced, even if ever so slightly, a shift towards healing. This is real progress, and we should take a moment to recognize it, because hope matters. The DEA and its leaders are the dealers in that hope. But let me be clear. This is not the end of the opioid crisis. It is not even the beginning of the end. We are at best at the end of the beginning. Because for all the lives saved, there are still too many lives lost. For every barrier that we have broken down, for every obstacle that we have overcome, whether it be in access to medication-assisted treatment, stigma, or harm reduction, there are others still standing. Synthetic opioids, new drug combinations, the cartels, technology, and social media continue to fuel this opioid epidemic. We will not allow our early progress to breed complacency. We now have momentum, and that is when we must double down. We must do more. The DEA is laser focused and committed to relentlessly pursuing those responsible for causing the most harm in our communities, and we will hold them accountable. We will continue our global pursuit forward mindset with our law enforcement partners to eliminate those criminal drug trafficking networks responsible for supplying fentanyl and other dangerous drugs that are killing our young people and harming our communities. This is the long fight, but we are turning the tide. Let us honor this progress, not with celebration alone, but with a renewed commitment. Because for all the work we have done, we are not finished. We still have work to do. This is a fight to save lives. Join us in that fight. Thank you.
I have a short message of gratitude and hopefully understanding from our families. DEA has supported us. Now everyone else is coming to the table. We don't call out for them. They call us now. Our fine men and women of CBP reached out to us in support this year. We have high-level government officials that did everything they could to try to be here today. A flyover was planned. It was unbelievable to me to know that so many people stand with us now. Our families know how important our national security and just the day-to-day tasks in our government are. There was another calling today, so our plans changed. But our families are here. Our angels are here. And we have much support from our New York Police Department, our CBP, our DEA, and so many fine partners around our nation that come here to stand with us. I would like to introduce to you now the City of New York's Deputy Mayor Daughtry.
Good afternoon, everyone. It's an honor to stand here in the heart of New York City on National Fentanyl Prevention and Awareness Day, alongside families, advocates, and public safety partners from across the nation. Thank you to the organizers, to the families who have turned the unimaginable loss into action, and all the agencies and organizations here are dedicated to saving lives. Today's theme, United in Prevention, United for Change, is not just a word, it's a commitment. Fentanyl is the deadliest drug our country has ever faced, and it takes lives indiscriminately in every neighborhood and across every background. In New York City, we saw how quickly fentanyl infiltrated not just the opioid supply, but other drugs as well, making every use of a potential deadly encounter. This crisis is not just about numbers. It's about our sons and our daughters, our friends and our neighbors whose lives were stolen far too soon. In New York City, our approach brings law enforcement, health professionals, educators, community leaders to the same table to share information, to coordinate responses, and to build prevention strategies that save lives. From the NYPD to the Office of the Chief Medical Examiners and our public safety health agencies, we are all aligned, sharing data, resources, and expertise. And all are focused on one single goal, to save lives. Our strategy in New York is very, very clear. We are attacking this epidemic from every front: prevention, intervention, and aggressive law enforcement. On the prevention front, we are expanding access to life-saving tools like Narcan and fentanyl test strips, ensuring that every New Yorker has the chance to save a life when seconds matter. On the intervention front, we are connecting people struggling with substance use disorders to treatment, housing, and wraparound support, because recovery must remain an open door, not a dead end. And on the enforcement, let me be very, very clear. We are relentlessly targeting the criminals and the traffickers and who profits from poisoning our communities. In close partnership with our federal partners, our law enforcement teams are seizing records amount of fentanyl, dismantling traffic pipelines, and holding criminals accountable. We are working hand in hand with our federal partners, including the DEA, the CBP, Homeland Security, and the Department of Justice, because traffickers don't respect borders, and neither can our response. We are sending a very clear message. If you put fentanyl on our streets, if you profit from other people's deaths and addiction, you will be caught and you will face justice. The truth is, the truth is, no city, no state, no agency can win this fight alone. But together, we can turn the tide. Every connection to treatment, every drug dealer behind bars where they belong, every life saved brings us closer to a fentanyl-free future. To the families here today, your courage was what fuels this movement. You have used your voices to make sure the world does not turn away from this epidemic, and we stand with you here, in grief and in action and in hope. Let's honor those lives that we lost, not just with words, but with action and work. The work that relentlessly unites us and has driven the belief that every single life saved is a victory. Together we will turn hope into action, and we will honor this commitment by keep fighting. And together we will save lives. Thank you.
Thank you, thank you. We would like to present our DEA, our New York DEA.
You know this was coming?
With a token of gratitude for your steadfast support of families impacted by fentanyl, and for standing with us in a moment of history when our nation faces its deadliest drug crisis. Your partnership brings hope, strength, and a voice to those we have lost. Together we fight for change.